Hi, my name is Puskas, and I'm a third-year dental student from Columbia University College of Dental Medicine, and I worked under the great mentorship of Dr. Stephen Morse from the Mailman School of Public Health. Together, we investigated the impact of the COVID-19 pandemic on dental care in the states of New York and Georgia. During the 2020 pandemic, there was an unprecedented forced closure of dental offices nationwide, and the effects of this have not yet been understood. So the study was conducted in an interstate comparison of the COVID-19 impact on oral health care in New York State and Georgia, whose management for COVID-19 varied greatly. The objectives were to better quantitate the withdrawal of dental care services in New York State and Georgia and investigate the impact of fear of COVID-19 exposure on patients seeking dental care. This entailed a 16-question Qualtrics survey that was sent to the membership of the NYSDA, the New York State Dental Association, and the GDA, the Georgia Dental Association, that encompassed questions including demographics, appointment cancellation rates, reopening times, and the volume of individual dental procedures provided to patients from March 1st to August 1st in 2020 compared to the same 5-month period in 2019. So 701 members of the NYSDA and GDA elected to participate in the Qualtrics survey, and 680 actively practicing dentists were included in the data analysis. As you can see in Figure 1, the sample demographics found that the vast majority of our respondents are solo practitioners who've been in practice for more than 20 years and do not accept Medicaid. And we understood that this narrow demographics could invite sampling bias into our data, but these demographic characteristics did not differ with statistical significance across NYSDA and GDA respondents. So also in Figure 2 on the top right, we found that the dental practice full reopening times for non-emergent care was consistent with the state mandated times for New York and Georgia to open for non-emergent care on June 1st and May 1st, respectively. Although we found in our study that at least 10% of both of those states waited an additional month to open after they were permitted to. Some New York dentists had yet to open their practice for non-emergent care in the time of September of 2020. And with the anonymity provided by the survey, dentists in both states admitted to opening their practice prior to the permitted time or never closing their practice at all to begin with. Next, New York and Georgia dentist respondents felt that 37% and 52% of patient appointment cancellations were due to COVID-19 exposure fear, respectively. And then finally, in Figure 3 at the bottom, we found that New York dentists reported a larger decrease in all dental care procedures, encompassing dental prophylaxis, elective procedures like direct restorations, crowns, and implants, more emergent procedures, including extractions and endodontic treatment, and specialty procedures like orthodontic and periodontal treatments. An antibiotic prescription was the only dental service that did not vary from their pre-COVID baseline with statistical significance across NYSDA and GDA. So in conclusion, across all the dental procedures during the pandemic, services by New York dentists appear to be more affected by the pandemic than Georgia dentists. And future investigations can use this quantification of the dental care provided during this time of the COVID-19 dental hiatus to assess the impact and repercussions of the COVID-19 pandemic on oral public health in the near and more distant future. Thank you.